other things related to vascular and pulmonary disease. So an important statistic I like to talk about is that about half of patients who come in with a heart attack had no idea they were either at risk or they had a problem. And screening is a way to identify patients who are at risk of a heart attack and help prevent them from having one. So this event involves a lot of different things. So one of the first things it involves is what's called a comprehensive cardiac screening. So that includes some blood tests for cholesterol, for glucose. You can get an EKG, a carotid ultrasound, and an abdominal aortic ultrasound, all for $35. We also will be offering a coronary artery calcium score for $99. During this event, there will also be available screening for COPD. There'll be a chance to ask the pharmacist questions about your medications. And just as an aside, I think it's really important that patients keep an accurate medication list with them at all times, name of the drug, dose of the drug, and just bring that with you to this event, and you can ask your questions to our pharmacist on hand. At the event, we're going to have some dietary sessions where you're going to be taught how to cook a heart-healthy meal. And then something else that's kind of different this year, and I think everybody has in mind the unfortunate events related to Damar Hamlin during the NFL game where he had cardiac arrest. We're going to be offering a session teaching patients how to perform hands-only CPR, and you'll have the opportunity to practice on a mannequin, and folks will be there to teach you how to do it appropriately. So for this event, free parking is offered. We'll be offering breakfast, and it is important to register. There's a phone number provided, and just call and let folks know that you'll be coming.
Great. Dr. Shep, we'll have a couple of questions. One person was asking about lipid panels. Could you talk about that, just why those are important and what that is?
Yeah, so a lipid panel is a blood test measuring the cholesterol levels in your blood. And there's many different types of cholesterols. Some people have probably heard of good cholesterol, that's your HDL, or bad cholesterol, that's your LDL. There's also triglycerides. We know that triglycerides and LDL being high contribute to heart attack and stroke risk. And we know that diet, exercise, and sometimes even medications can help bring down your cholesterol levels and subsequently decrease your heart attack and stroke risk.
Great. And one other question could you speak to or explain what is a coronary CT scan, just what goes into that?
Yeah, so a coronary artery calcium score is a CT scan of your heart. It's low radiation, and the purpose of that scan is to detect the degree of calcium in your coronary arteries. Calcium is dense, so CT picks up on it very well, and that calcium only gets in your coronary arteries if you're developing plaque or cholesterol buildup in your coronary arteries. And we know from really large studies that the higher your calcium score is, the more at risk of heart attack you are. So if you have a coronary artery calcium score of 0, your risk of a heart attack is extremely low. But as your score goes up, and we specifically say once it gets to above 400, then you're considered a higher risk patient, and you will want to talk with your doctor about ways you can reduce your risk.
And with Heart Month coming up, it's really probably a great time for maybe somebody who, because of COVID or hasn't been screened in a while, to get these preventative screenings are so important, aren't they?
Absolutely. We know a lot of patients kind of neglected themselves during the COVID pandemic, and this is a chance to kind of re-engage with us. We're here to help you. We want you to know what your risk is. We want to try to help bring your risk down, and this is an event that can certainly help achieve that goal for you.